Welcome everyone. Thank you for joining us for today's special webinar for CEOs. My name is Marian. Today, we're presenting Sustaining Improvement in Your Healthcare System using the Baldrige Framework to Manage Tactics, presented by Dr. Kate Goonan and Dr. Stacey. Let me give you a little background about our presenters. Kate Goonan, Managing Director, is a NAVIGANTS performance practice, a national expert in performance excellence, academic health centers, and systems. She has 25 years of physician executive experience across systems, medical groups, and health plans. A former judge for the AHA Quest for Quality and Baldrige National Quality Awards. She is also a former executive director of the MGH Center for Performance Excellence. Stacey, Managing Director, is a member of NAVIGANTS Performance Excellence Practice. He leads NAVIGANTS Leadership Institute that supports cultural and organizational changes to a value-based environment. He has approximately 30 years of healthcare experience. He was named twice as one of the modern healthcare's top 100 most influential people in American healthcare. He is also a former chair of the board of directors of American College of Healthcare Executives. Just a little housekeeping before we get started. If you have any questions during the webinar, you can enter your questions into the questions pane and click send. The presenter will be answering questions after the presentation. Recording of today's webinar will be available at the IHF website. Now, without further ado, we'll turn the time over to our presenters, Dr. Stacey and Dr. Goonan.
Thank you very much. This is Stacey, and as mentioned, I am with Navigant Healthcare and have worked with my colleague, Dr. Goonan, for many years. Several years ago, she was fortunate, we were fortunate enough to receive the Malcolm Baldrige National Quality Award, and she was the consultant who helped us in that process, and she and I have stayed close ever since and have been working on how we can use the framework of the Baldrige criteria to help organizations sustain improvement. The issue that we're trying to address as we move forward is what we think is a traditional cycle that organizations go through. As time goes on, organizations' costs rise. Typically, they'll hire a consultant to come in and make improvements to their organization and drive costs down, which is usually successful. When the costs are down, the consultant leaves, and then we are back to business as usual, and it ends up that the costs start to increase again, at which point we have to hire a consultant one more time. This is good for consultants. I don't know that it's good. I don't believe it's good for healthcare. I don't think it's good for organizations, and I know that it's not good for patients, which I believe is our primary and ultimate responsibility. Dr. Goonan and I have been successful in helping organizations, as we drive out costs, simultaneously overlay the Baldrige Framework. And so as we drive costs out, we adopt the Baldrige Framework, and the Baldrige Framework is successful in creating the system to allow for continued improvement, so that when the organization's costs are down, rather than having that cycle that we just talked about where the costs go back up, with the fully deployed Baldrige process, the costs are able to stay down, process is in place, and patient care becomes the focus, not running around trying to save costs or cut costs here or there, but we're able to focus on truly what is the most important part of our organization. In the past, we've seen, as certainly in the United States, and as I work more and more internationally, I see this as well, that we try and address many different things, and sometimes we use one tool and sometimes we use another tool and to address costs or quality, and the result oftentimes is that we leave ourselves overwhelmed. We think that we need to improve employee satisfaction, and that's true, but sometimes we do that at the expense of our high reliability indicators, or we miss the opportunity for a lean program, and as we're trying to improve culture or governance or any one of a number of things. So what the criteria of the Baldrige Award does, and I should say here too, I've worked at some length with the European Foundation for Quality Management as well, and the EFQM criteria are similar and achieve similar outcomes, and across the world many organizations are using EFQM. And so today I'm going to talk about performance excellence tactics and process that is specific to the Baldrige but not unique to the Baldrige program. What the performance excellence tactics do is it takes organizations that could be, that have in the past been moving toward just reacting to problems. As a problem comes up, you can see in the top left portion of this diagram what happens sometimes in our organizations. We have very well-meaning people going in different directions because they have no system that drives them where they need to go. Organizations that have early systematic approaches, at least as evidenced there in the top right-hand portion of the slide here, they get everybody at least going in the same direction. Eventually, we can get organizations that have different departments and different entities aligned in where they're going, and they're moving in the same direction, aligned in their strategic goals. And when an organization is able to integrate all those approaches, they're able to reduce duplication, drive variation out of their organization, that nobody does the same thing twice. We find out what needs to be done in the organization. It's done in the right part of the organization by the right people in the right place at the right time. Patients are benefited, costs are reduced, and truly the system is in place to be sustainable. One of the issues that we hear oftentimes, particular to the Malcolm Baldrige National Quality Award, is how do we pay for that? How does the process pay for itself? Well, what we found is that organizations that use the Baldrige Award, particularly those that have had site visits, have faster 5-year improvement than their peers. They're 83% more likely to be in the top 100 hospitals in the United States, and in 6 of 7 times they've outperformed other top 100 hospital measures. A recent recipient from St. David's Healthcare said that they have adopted the framework to know that we're getting better, benchmark ourselves against organizations not in just in our industry, but across all industries. It gives us that chance to be disciplined and to move forward. For me, in my history with Baldrige, that's what it does, is it forces us to look at best practices, not just in healthcare, but truly in many industries. And in my career, I've learned from many different organizations and hospitals and hotels and delivery companies, many. There's 80% of the top 100 hospitals use Baldrige in some criteria, and 70% of teaching hospitals. I won't belabor that. I believe that it's a very highly productive process that can help an organization. And I will now turn it over to my colleague, Dr. Goonan to give you some specifics on the Baldrige Performance Framework. So, Dr. Goonan?
Thank you, Rulon. So this is a picture of the Baldrige Framework, which is the way it's the visual that describes a systems approach to running a health organization, whether it is a clinic or it is 100 hospitals run by a country's government. These elements are very similar, whether you're using EFQM or many other countries have their own adaptation of this, and often they look somewhat different, but the fundamental concepts are the same. I am a primary care internist. I'm a general physician, so I think of the human body and patients as holistic beings, as systems. The Baldrige Framework allows you to think of your healthcare organization and all the people who work in it in the same holistic way. I see it as like human physiology applied to organizations. So what I want to show you just briefly is a little bit about this picture and what it means. And I'm going to go into it in a little bit more detail in a bit, but the next slide shows another way to portray this picture. And Dr. Stacey, there we go. So now this is actually the same information in a different picture. The point of showing you these pictures is to help you realize we need to think of our organizations, which are truly very complex, as systems. And it's not about winning an award. It is about developing the capabilities to manage these hugely complex systems. So some organizations in the United States, and I would imagine in your organization or in your country, people are not comfortable with the idea of pursuing an award. So we turned it around here and we said, okay, great. This is the Navigant blueprint for organizational capabilities to achieve organizational excellence. And we never use the word Baldrige, it's just there in the little lower right-hand corner. But what this visual shows you is, you know, what are all the things that executives like yourselves have to oversee and do well? They have to lead, and they have to have a system of processes and people and committees that lead the organization. They have to work on their culture and make sure that their culture is strong. They have to have a strategy, and they have to be able to execute the strategy. They have to understand who is the market, who are the customers in the market we are serving, and how do we ensure we're serving them. We have to engage our workforce around delivering the right care and the right products to the right people at the right time. And we have to manage very often very complicated operations. And underlying all that, we have to build some sort of measurement and information system to help us make good decisions. And then all of that produces the results that our organizations produce. The benefit to the patients, the value to our communities, the quality, the safety. And so this framework puts all of that together and gives us a structure around how we think about it. Our language might be different, like we might be committed to high reliability or patient safety, or we might be committed to a unique and exceptional patient experience. And we have things that are our priorities that we talk about. The Baldrige Framework, whether you're using it in the US format or the European format or the Shanghai format, whatever you're using, it's only questions. It's not the answers. And high reliability might be one of your answers, or Lean Six Sigma or Toyota Way might be one of your answers. But the framework, regardless of what country you're in framework you're using from which part of the world, is questions. Each organization has unique answers. And then the next slide just points out something that we think about a lot as we look at US health systems, where we might say have 2 or 3 hospitals or 10 or 20 hospitals in a system. we, again, as executives, it's very important to be able to begin to organize how we're going to oversee the complex enterprises that we run. So you see across these verticals, we may have hospitals and physician groups, and we might even have insurance companies or a network of home health or workers or settings in which we deliver care across a large geography. We have to organize that in some way, and then we have to oversee that. And then across these horizontals, we may organize our work and the executive leadership of that work by service lines or by shared services between countries or between governments or between agencies. And then we have to figure out how we configure the supporting services like transactions of money and how we're going to organize our financial operations to be able to support the operation. So the Baldrige process helps us begin to think about our whole enterprise as a system and how we're going to organize it to deliver optimal results. And the next slide then is just a, you know, in the United States, and I would assume many of you have heard of the triple aim, the notion that we have multiple things that we need to be attending to simultaneously. And this is just a visual about, you know, we have to take care of whole populations of people and measure the impact we're having on health status. We have to be able to demonstrate efficiency around our per capita, per person costs. And at the same time, we need to try to make that experience one that is respectable. The Baldrige Framework, again, helps us to be very system-oriented in thinking about these complex questions. And the next slide what I'd like to do is describe to you the approach that we've developed over the last 15 years. So in my work, it's been now 15, 20 years ago when I first got introduced to this system of systems approaches. It's like a systems engineering approach to executive leadership. And in the 12 years ago, we studied the first 9 Baldrige recipients, including Dr. Stacey's organization, Poudre Valley Health System. What we wanted to understand was what did the executives do that was different than other organizations? And we published this book that's photographed here. And the next slide shows the first thing that we learned. The first thing that we learned is that organizations, all organizations, consistently describe going through these stages. And if you think of the vertical axis here as a score, say 0 to 100, and the horizontal here is over time, and these were not accomplished in 3 months. These were work efforts that went on for a period of time. But consistently, organizations that go from very mediocre to significantly higher performing in terms of the triple aim and performance overall, they go through a period of time where all they do is what they're told to do by the government or by regulatory agencies, and their performance is usually quite mediocre. Then they go through a period of time when they have people that learn how to use project tools, process improvement tools, and they use Lean and Six Sigma and DMIC, and they may use make up their own tools, but you know, they start using business acumen and engineering tools to improve performance, and they get some improvement, but typically they can't sustain it because they haven't developed the underlying capabilities at the executive level to sustain these improvements. And then uniformly, these organizations realize we can keep trying to do projects and we're never going to really get any better. So then they realized they needed to also look very carefully and systematically at their leadership and management processes, structures, and who's doing what in executive roles and in leadership and management roles. And they used the Baldrige Framework and the body of knowledge, which is all public domain. You can access all the U.S. Baldrige Award recipients' applications and read them and learn from them. Everyone can, and I know you can do that as well with the EFQM databases. It's all on the internet. So then they started looking at how they're structured to lead and manage. And if they quickly realized, okay, this is clearly not just about organizing a project to win an award. the people who were out to win an award and not really transform fell off very quickly. But the others who were prepared to really make an effort to figure out how to build a high-performance business began to finally get traction and finally improve. And then over time, as they built processes and changed the way they do the work of each of those boxes in the framework, so leadership and culture, strategy and execution, market analysis and customer, how they manage the workforce and how they manage operations, as they really started doing that in a more systematic way, then they really significantly improved and in fact became Baldrige worthy. So that was a really powerful learning to see this pattern of what it takes and the phases organizations go through as they begin to improve. But the next slide shows that while that helped us to describe this pattern over time, we still didn't have a roadmap. We still didn't know, how did they do this? What did they do to go from pretty mediocre to really pretty extraordinary? What did the leaders actually do? And we organized what we learned from all these organizations into this model, the laser model. And we thought it was very relevant that practices that executives engage in to lead their organizations differently, and the practices that people use to assess the organization, and then how leaders work together to make sense of assessments and know what to do and what to prioritize and which capabilities to build to be successful. And then how do they actually manage the work? How do they execute on the work in order to enable them to really get the results that they needed to get? And the next slide I won't go through in detail, but if you're interested, it just outlines in very specific terms some of the key lessons that we learned about what actually did the executive leadership teams do to accomplish a major transformation. You know, what kind of actions did they take? And then how did they construct and walk through an assessment? What is that importance of its sense making is actually extremely important. We took that term from the safety sciences, and I'm sure all of you have been studying in recent years, or at least becoming aware of. How do you make sense of your organization as a system, and what are the priorities for change? Is a very important executive skill. And then obviously, what do we do to go about the business of getting real change to occur? And then finally, how do we ensure that we're going to in fact get measurable results that we can use to prove our organization is worth funding, our organization is valuable to our community, to our state, to our government, to our customers, to whoever pays the bills, regardless of whether you compete with other health plans or you're in a completely isolated environment. You have to prove that what you're doing is valuable, and you have to have results to do that. So the next slide is just a little bit more detail about how the Baldrige diagnostic tool works. And as I mentioned, I'm basically a physician by training, and the thing to think about is this framework is a diagnostic tool. It isn't the solution. It is a diagnostic tool and a framework so that when you're thinking of doing this program or that tactic or this thing, you've got scaffolding or an architecture, you've got a framework to put those pieces together so you as an executive can in fact lead the organization. And you can make choices as to which tactics and programs and methods you read about or you hear about at conferences fit into where you're leading your organization to go. So in 2 minutes, I just want to teach you everything you need to know about the Baldrige Framework. And again, this basic concept is true no matter what, whether it's EFQM or any other country's model. The pictures look a little different. The concept is the same. And this is the executive knowledge that you need to know. You don't need to know anything more about the Baldrige criteria other than this to use it as a CEO. The first thing is that your organization is unique. You have a unique strategic context. Some of you probably work for organizations that are paid for by a government and you have no competitors. Other of you may work in a market where you actually have competitors, or perhaps you're losing patients or funding to someone else. Everyone's situation is completely different. The diagnosis, the power of the Baldrige Framework is that it's customized to you. So what you need to build in terms of capabilities is going to be quite unique. So step number one, what is the strategic context and the challenges you face that you have to build an executive team to overcome? Then the next slide shows the basic model, which is, given your strategic context, your challenges, your barriers, your obstacles, what are the key processes and approaches and tactics you need to overcome those challenges and deliver on organizational results? And if you click one more time, it just points out that leaders are accountable for creating results by the way the decisions they made about what approaches, processes, and tactics they're going to use, how they're going to integrate those tactics and approaches to produce organizational results. And that's how you sell the value of your executive leadership to whoever your key stakeholders are, who judge whether or not you deserve to be CEO. And this, in the United States, I don't know what it's like in other countries, but in the US, we have a very high rate of CEO turnover at this point. They get held accountable for anything that happens in their organizations under their watch. And it's a very tough job in this day and age, given how much change is going on. So we have to be in a position to prove that we know what we're doing, that we can take responsibility. And that means building capabilities that other people manage, not the CEO. Other people have to manage the strategy and the measurement systems and the operations. It's a very tough job. And the next slide just says this in words. The next slide just says this in a different way. The diagnostic test says, what's important to us? Who are we? What do we do? And what is our strategic environment? And how do we improve our business, whether we sell cars, or we run a hotel, or we run a hospital? And then how do we lead and manage? What are the systems and tactics we put in place to lead and manage the enterprise? And then, given how we lead and manage, what are the results we're getting? And as you can see, in every important domain. So it's the healthcare outcomes for the patients we serve, the customer satisfaction with how we do our work, workforce and how engaged the workforce is, leadership and governance, how well we can identify a strategy and then execute on it, and then what is our market share and our financial efficiency and our financial results, and how do all those results compare to others similar to us. And the next picture is just the same framework again, but it's shown in a slightly different way. It points out, so if we click slowly through these, it shows it, again, this is a diagnostic tool. So our answers might include high reliability or balanced scorecard and Hoshin planning or strategy maps, or we might use the Studer group or the magnet criteria for nursing to help us manage our workforce. We might use Lean or Six Sigma or PDSA to manage our operations. We have lots of choices to make, and we can't just pick up on every single one of these things. We have to know which ones are going to help us achieve our goals. What I can tell you is one lesson I learned looking at these organizations that very successfully transform is they customize and homegrown a lot of stuff, and they imitate. They SWIPE as an acronym for Steal with Integrity, Passion, and Enthusiasm. That's a Baldrige term in the United States. It's so much better to read a book about tactics in Lean Six Sigma or Toyota Way or customer service, and then adapt it to your organization and your culture. And the ones that really got the best results are the ones that rarely brought something from somewhere else and gave the other folks credit. They usually brought it home, made it their own, and they got better results for doing it that way. So, and then the next slide is just, I want to show you an example of a kind of feedback that you get from a Baldrige assessment. So here I'll just show you this briefly. You can see in the upper right-hand corner, there's our Baldrige Framework, and that little red arrow is pointing to strategy. So as an example, as just one area of 18 areas where ideally you really need feedback is 2.2 in category 2, the second part. How well are you doing on implementing your strategy? And see, we've got strengths, and OFI refers to opportunities for improvement. That might just be a US term, or it might be a term that's throughout the use of this framework and performance excellence around the world. I'm not entirely sure about that. But opportunities for improvement are what are the things you need to do differently if you're going to get better results on your strategy? And then what are the action steps? Now, this is not what the award programs give you. This is what we as Navigant give people when we bring in this methodology into their organizations to help them get on the path of making major transformational change. And then the scoring down here, this is very indigenous to all these Baldrige-based programs, is you get a grade. You get a grade, and this organization got a 10 to 25 on its ability to implement strategy. That was not a happy day when people looked at that and realized they only got a 10 to 25. And like most people in healthcare, this organization was quick to say, how do we get that number up? How do we move to get a better score? And so the other aspect of all this is to get a numeric score and be able to say to your own staff, okay, person who's in charge of strategy, I expect that score to go to 30 to 45 or 50 to 65 by next year. It's a very powerful tool to use. So with that, I'm going to turn it over back to you, Rulon.
Kate, can I ask you a question about this?
Absolutely.
While we're on this topic? So if somebody were to go to AFQM or to Baldrige or to some program that analyzed an organization's participation in this performance excellence criteria, if we go back to that slide number 27 that is 2.2 strategy implementation, they would receive a report that had the strengths and then the opportunities for improvement. And we've added on the bottom what action steps that, as a result of what Navigant does, they would recommend to this organization. But with or without Navigant, or with or without some external source, do you recommend organizations create those kinds of action steps, and how would they do that?
Well, as organizations adopt this methodology as their part of their way of operating, so and in this, the CEO and the board or the governance of an organization says, we want a periodic assessment of the organization. We want a grade and a score, and we want to know an action plan that comes out of it. Organizations get so they do this on a periodic basis and score themselves. And then the next obvious step is, well, given our strengths and opportunities to improve, what action steps should we take? In that context, the first thing I always recommend is to look at award recipients and how they do it. So when I see a score like this and I'm trying to figure out an action plan, I take this list of opportunities for improvement, and then I read the application of an award recipient organization and compare how this organization is doing it compared to one that has been at it for 10 years and built a very well-developed, well-deployed, implemented strategy implementation approach. And I go compare them, and then you can yourself draw conclusions comparing yourself to someone who's a very high-performance business. And in this area, it has nothing to do. It doesn't matter if it's healthcare or not. It can be any type of organization. Being good at strategy implementation is a core competency for any organization and any executive leader.
Well, I appreciate that feedback, because as the CEO of an organization that was able to obtain this, the Baldrige Award, that third line down there, the action steps, became more meaningful to us. And here's another one from 7.5, category 7.5, which is financial and market results. And just as examples, but for us, the most important part of this process became that feedback report. We would spend a year working, making changes, doing things that we could, so that at the end we could receive that external verification of our internal efforts. And with that, we would make the changes we needed to and start the process all over again, so that we could truly develop this cycle of improvement going forward. That's what made the difference for us, and I think what was crucial. So with that, if we have time for questions, I'll go back up to the top slide here so that you know who you're talking to. And are there any questions for us?
Thank you, Dr. Goonan and Dr. Stacey. We'll go ahead and take some time for questions now. Reminder to attendees, please type your questions in the questions pane and click send. So our first question is, what are the benefits of thinking and acting like a system as the industry moves to drive variation out of healthcare?
Well, I would suggest that is the benefit of thinking and acting like a system. I think that we no longer in any country have the luxury of duplicating services and paying for services twice. We've got to identify the best practice. We have to duplicate that best practice. We have to make sure that our patients have the access to the very best service, the very best time, and in the very right exact place. That's what we do as healthcare executives. And thinking and acting like a system, gaining this data allows us to ensure and demonstrate that that's happening and prove that that's happening. Kate, thoughts you have on that?
Yeah. It also, you know, we historically managed our people as professionals in healthcare. So we had doctors manage doctors, and nurses manage nurses, and pharmacists manage pharmacists. And we operated on a professional model. And that may have worked 50 years ago, but it really does not work now. It's not an effective approach given the complexity and interdependency of the services we're providing. So all those people have to work together in teams. When they could all work independently and work separately, and that was adequate given what we do in healthcare. And there was a time that was true, but it's no longer true. Now we have to be very, very well coordinated. We have to be able to hand off tasks one to another person. We have to have protocols and standardized approaches to how we do things. I'll give you an example. In this country, and it's going internationally through the work of leading organizations like Intermountain Healthcare in Salt Lake City, we're starting to realize that what goes on in a hospital for surgery actually really should start at home and then continue after the patient leaves the hospital. And that the use of the hospital should be very focused on only those things that need to happen in the hospital. So we need a process that begins a month before the patient is going to have surgery to prepare them for the procedures so that they can be discharged quickly and they will recover quickly and they can go back to work. That requires a systematic engineering approach to running our businesses. Simply supervising individual doctors and nurses within their professional discipline is no longer sufficient to be able to do the work. So that means we really have to be able to adopt a systems approach to simply stay in the game, especially for executives. In this country, in the United States, a CEO of a hospital the job used to be to keep the board happy and the doctors happy, and otherwise stay out of the nurses and doctors and pharmacists' way. And they went to school, they knew what to do. Those days are over in this country, and hence we're having a lot of CEOs come and go in their jobs pretty quickly when something bad happens. The other thing that we're facing, and I know everyone else here is as well, is our quality and our patient experience is being measured, and it's increasingly publicly available. And those scores can't be changed by sending out an email or telling people to try harder. That won't change those scores. We have to have a systems approach if we're going to successfully improve our performance on a lot of those publicly reported measures.
We still have time for a few more questions. Another question is, in what ways are Lean or Six Sigma insufficient in maximizing organization-wide performance?
Well, Kate and I actually just authored an article that we should make available to the people who want that address this. Lean and Six Sigma are very, very appropriate and successful tactics to use to address very important problems. But what they don't do is look at an organization-wide system and find out how the entire organization is working. They will help you identify a process, a specific process, and reduce the variation in that specific process, but it can't help the governing board work better with the nurses, work better with environmental services to address a common goal. And that's why the performance excellence criteria is important, because it does give you that system-wide approach. The tactics like Lean and Six Sigma that I use and have used my whole career and am very fond of can't use on a system-wide basis. Kate, what did I leave out on that?
Well, no, that's exactly right. So if your organization has to set and achieve, let's say they have to set and achieve 5 very important goals. You have to learn how to manage a population health problem like diabetes, or screening for infectious diseases, or coordinating with other agencies to help people with smoking cessation, any number of problems you might have to take on. Lean Six Sigma, in theory, could help you with the challenge, but ultimately you have to be able to build leadership processes to set goals around those problems, prioritize which of those goals you are capable of achieving, and then execute on those goals. You have to be able to show, I can set 5 goals, and we can make an impact on the populations we serve and some of the particular health conditions that they have, whether it's an infectious disease condition or it's chronic disease of some kind or cancers, whatever it is, we can have an impact. Well, Lean and Six Sigma might help you with a small piece of that project, but build the capabilities to set the goals and execute the goals and measure your progress against the goals. That requires higher order systems thinking and higher order system design and process design. There's still actually process skills, and you're building a process for doing all these leadership and management tasks, and there's some relevance for Lean and Six Sigma. But they're very much focused at the micro system, and if you're going to build a healthcare delivery organization that's going to accomplish the many complex things that we now have to accomplish, it will take more than that. And the framework gives you the blueprint, so you use it like it's a blueprint for building a house, and you figure out which parts of the capabilities in leadership and management are most needed. For example, a big one for most organizations is getting organized around what kind of data they can and will have to support operational leaders in the work that they do day to day. There's not a lot from Lean and Six Sigma that will help you accomplish that.
We have another question. How does this process help administrators guide improvement long term?
This process is the long-term solution. I think this chart is probably the best one to look at and answer to that question. It's hard to get into this process and think that you're going to have results in the next quarter. And if you're in the second quarter of the year and you're trying to get third quarter results, this process is not really going to help you do that. That's why we have argued for a combined approach to get the results you need now, but then overlay the Baldrige criteria, the performance excellence criteria, to sustain long-term improvement. For an administrator, so as a CEO myself, this is the guide to do that. If I want to know what do I need to do to sustain long-term improvement in my organization, to develop and sustain long-term improvement, I go through the questions of the Malcolm Baldrige National Quality Award criteria. I ask those questions and come up with meaningful answers, and that is the guide. That's the guide that I need. It takes a year to answer them, but the results that come in trying to answer those questions as you work for the answers give you the guide that you need going forward, and that is the long-term solution. I've told Dr. Goonan this before, that one of my most proud moments in our organization was not after we won the Baldrige Award. It was several years after that, when we were focused on a merger and we had been tied up with a new electronic medical record implementation and everything else was consuming us. Yet we still were able to receive the highest level of the Baldrige Award in the Colorado State Award, but it was because our systems were set up. The process had been set up, and it sustained us going forward even when we were focused on other things. That to me is the greatest accolade of this criteria.
You know, Rulon, I remember that so clearly, watching the team that you led and how it matured. And initially, most people have talented people on their team. You know, some people are more capable and productive than others, but hopefully you're able to surround yourself with other people who can help you, who are accomplished administrators. But they tend to, early on in the organization's maturity, they solve all the problems themselves. They try to do everything themselves. That gets you only so far. And when I remember with Poudre Valley early on, this very committed group of people were trying to do everything themselves and doing a pretty darn good job. But when they started using the criteria and answering the criteria and saying, so how are we going to set goals, and what's the process we're going to use to set goals and implement those goals? And when they took that on and did that and built a habit around it and built a schedule, and people learned, okay, in July this meeting's going to happen, by September we will have this plan in place, and then, you know, they got into a rhythm. Everyone knew when things were going to happen, so then they could take on a merger, and they could take on building a new hospital, and they could take on the EMR implementation. And these big challenges, they had a method. They knew how to work together as an executive team to manage far more than they could possibly manage if each one of them was out there trying to solve a problem every day, solve problems all day long. And it was just so impressive to see how different work was like for that executive team over the years that they used this framework.
Okay, it looks like we've covered all of our questions. Dr. Goonan and Dr. Stacey, is there anything else you wanted to cover before I wrap up?
Well, I just want to thank everybody for joining us. One of my other assignments from the International Hospital Federation is the chair of the CEO Circle, and we are very much looking forward to meeting with everybody this fall in Taipei And one of the topics of the session, of one of our sessions, is going to be on this topic. And we'll look forward to exploring this in greater detail at that meeting, and then also at the breakfast for CEOs who are in the CEO circle one of the mornings in Taipei. So much more to come on this and other topics. We'll look forward to staying engaged with everybody in the CEO circle.
Thank you so much, everybody.
Thanks again for joining us today, and we'll see you next time.